Hi, everybody. This is Dr. Britt Talley Danielle, MD, and I'm a neurologist and headache doctor. And today I'll be talking about, do energy drinks cause hemorrhagic strokes? A stroke is a terrible neurologic event. I heard in neurology training years ago that some in England called a stroke a shock, which says something about the suddenness of the event and the later emotional toil of a stroke. Many persons use energy drinks for that extra high that comes from drinking them, providing just the needed energy to stay awake and do that job, or finish that long drive, or see the end of that great movie. The problem is that what is in all energy drinks is not known, and energy drinks are not USP, which means United States Pharmacopoeia, or FDA, which means Federal Drug Administration approved. The purpose of these organizations is to protect persons from harmful products. Energy drinks are all considered to be supplements, and for these products, let the buyer beware. Energy drinks may contain caffeine or amphetamine-like products such as pseudoephedrine and phenylalanine. So the question is, do energy drinks cause hemorrhagic strokes? Energy drinks can cause sudden surges in blood pressure to high levels, causing hemorrhagic strokes. The elevated pressure that results from consuming energy drinks ruptures small brain arteries, causing bleeding directly into the brain. Strokes in the brain kill 140,000 Americans each year, which is 1 out of every 20 deaths. Stroke attacks someone in the United States every 40 seconds. Every year, more than 795,000 people in the United States have a stroke. Strokes can repeat or happen again in a susceptible person, those with overweight, atherosclerosis, hypertension, diabetes, heart disease, or elevated cholesterol. Previous strokes occur in 185,000 strokes, or in 1 of every 4 persons. About 87% of all strokes are ischemic stroke, in which the blood flow of the brain is blocked either by a small blood or cholesterol clot, called an embolus, or from a completely closed neck or cerebral artery, called a thrombosis. Stroke is a leading cause of serious long-term disability and often has a major effect on personal mobility. Hypertension is the main natural cause of cerebral hemorrhage. Treating hypertension has reduced the incidence of cerebral hemorrhage significantly. However, the combination of energy drinks causing surges of increased blood pressure, combined with a person who has hypertension, is a very bad situation. Intracerebral hemorrhage has an increased mortality over ischemic stroke. Strokes related to hypertension and bleeding in the brain itself cause more mortality than ischemic stroke. A literature review of increased mortality from intracerebral hemorrhage is found in the following article by Weimar et al., writing in Review of Current Pharmaceutical Diseases 2017 on Epidemiology, Prognosis, and Prevention of Non-Traumatic Intracerebral Hemorrhage. This was an abstract. The background. Spontaneous non-traumatic intracerebral hemorrhage has a worse prognosis than ischemic stroke. The purpose of this review was to update the reader on epidemiology, prognosis, and secondary prevention strategies of cerebral hemorrhage. Methods. We performed a selected review from the literature, including recent original articles and meta-analyses. The results. Intracerebral hemorrhage has an overall incidence of 24.6 per 100,000 patient years, which is considerably higher in Asian populations. Despite some progress in acute interventions and a great increase in clinical studies over the last decade, mortality of intracerebral hemorrhage remains high. In addition, survivors remain at increased risk of a recurrent hemorrhage as well as ischemic stroke. Conclusion. Knowledge on risk factors and prevention strategies can greatly decrease the incidence of intracerebral hemorrhage and improve prognosis of intracerebral hemorrhage survivors. Hemorrhagic stroke from an energy drink. This next is a review of an article by Venkataraman et al., who gave a presentation of the 2017 American Academy of Neurology Annual Meeting Science Program published in 2017 on hemorrhagic stroke following consumption of an energy drink. Investigators at the University of Alabama at Birmingham have presented the first case study of a patient experiencing a hemorrhagic stroke, a brain bleed, following consumption of an energy drink. In an article in Press in the American Journal of Emergency Medicine, these physicians detail the case of a 57-year-old man who developed intracranial hemorrhage within 15 minutes of drinking a popular energy drink. The patient presented at a local emergency department and was transferred to the stroke unit at the University of Alabama at Birmingham with symptoms of sensory changes, tingling and numbness in the right arm and leg, along with ataxia, which means shaky gait and movement. A CT scan revealed a small hemorrhage near the left thalamus. The man reported that his symptoms began about 15 minutes after drinking an energy drink, the first time he had consumed this particular product, as he was about to do yard work, said Dr. Venkataraman, MD, a fourth-year resident in the Department of Neurology, and the lead author of the study. The doctor said the drink contains a high level of caffeine along with a variety of other ingredients, many of which are associated with increases in blood pressure. This particular drink contains several supplements for which we have little understanding of their potential interactions with each other or with caffeine, the doctor said. One is structurally similar to amphetamines, and several are known to stimulate the sympathetic nervous system. The sympathetic nervous system regulates what is known as the fight or flight response. When faced with an urgent, potentially dangerous situation, the body gears up to either take extraordinary action, which is to fight, or run away, which is flight. The body begins to marshal all its resources to respond to the situation at hand, boosting strength and alertness, for example, in part by raising blood pressure to increase blood flow. Dr. Venkataraman said, for a patient who may be at risk for vascular disease, this increase in blood pressure could be potentially dangerous, as a rise in blood pressure can affect an already weakened blood vessel to the point that it ruptures. Ingredients in the drinks that are suspected to influence the nervous system include beta-phenylalanine hydrochloride, yohimbine, and green tea extract. These ingredients are supplements and as such are not regulated by the government to the same degree that medications are. We don't have good information on dosing for some of these supplements. We don't know how much is too much, for example, especially in populations with varying degrees of risk. Another issue is serving size. The manufacturer's label says the bottle contains 2 servings, but the patient reported that he drank the full 8-ounce bottle at one time, a behavior that Dr. Venkataraman believes is common. The warning here is that we do not fully understand how some of these ingredients interact with other compounds, nor do we have enough information on maximum dosage, especially for individuals with underlying health issues. Consumers need to be aware of the ingredients in the drinks if they choose to use them, and check with their physician if they have questions. They should also follow the manufacturer's recommendations. In this case, the patient had a history of elevated blood pressure and was at increased risk for vascular disease. Several months after the incident, the patient reported he still had some residual effects from the incident. I am not anti-energy drink, Dr. Venkataraman said. In fact, I use them myself on occasion, but I strongly urge consumers to read the label and be informed. Don't take unnecessary risks with your health. There's potential for serious outcome. Another article was regarding this subject was published by Dr. Grant et al., writing in Review of Interventional Neuroradiology, December of 2016, on aneurysmal subarachnoid hemorrhage and severe catheter-induced vasospasm associated with excessive consumption of a caffeinated energy drink. And I have an abstract here. Excessive consumption of over-the-counter stimulus is associated with coronary vasospasm, thrombotic complications, and sudden cardiac death. Their effects on cerebral vascular physiology are not yet described in the neurointerventional literature. Patients are increasingly exposed to high levels of these vasoactive substances in the form of caffeinated energy drinks and specialty coffees. We report a case of aneurysmal subarachnoid hemorrhage and severe catheter-induced vasospasm during attempted endovascular repair of a ruptured anterior communicating artery aneurysm in the setting of excessive energy drink consumption. We review the literature and alert clinicians to this potentially serious medical complication. Another article was entitled Herbal Energy Drinks, Phenylpropanide Compounds in Cerebral Vasculopathy, written by Dr. Worrell et al. In Neurology, 2005. This was hemorrhagic stroke after consumption of an energy drink. And they reported a 21-year-old man with cerebral vasculopathy and concurrent ischemic and hemorrhagic stroke shortly after his first exposure to an energy drink containing numerous sympathomimetic herbal compounds. Several hours after drinking 250 milligrams of the energy drink excess cranberry grape blast, the patient had onset of profound headache and hemiataxia while on a bike with friends. His medical history included type 1 diabetes, asthma, and remote syncope. He denied exposure to over-the-counter stimulants, cold preparation, diet aids, or illicit drugs. On exam, he had photophobia and marked hemiataxia. His imaging revealed an acute brainstem infarction and bilateral subarachnoid hemorrhage on the cerebral convexities. The article I have online of this at www.drmigraine.com. I have the picture of this image of this MRI scan. The manufacturer's website is also listed on my blog, and it indicates that this energy drink contains an adaptogenic mixture of herbal compounds, and they list them all there. One of which is a mushroom, the other is a kind of a milk root, another was a Chinese magnolia vine. The manufacturer states that adaptogenic herbs aid the body in managing stress. 3 constituents of this blend are in the energy drink, and they're sympathomimetic, and all contain phenylpropanol drugs and other potentially, vasoactive compounds. The FDA requested withdrawal of phenylalanine from all prescription over-the-counter drugs in November 2000, based largely on evidence of cerebrovascular disease risk. And I have a link to that article on my webpage. Also, exposure to herbal sympathomimetic substances, including ephedra and ginseng, is a risk factor for cerebral vasculopathy, subarachnoid hemorrhage, and ischemic stroke. The terms vasculitis and vasospasm are both used in the literature to describe the angiographic findings, although the more generic term vasculopathy is more appropriate. This case highlights the potential relationship between pharmacologically active and widely available herbal supplements and cerebral vasculopathy, although we cannot unequivocally prove a connection. The patient's diabetes, a known vascular risk factor, may have also altered his susceptibility to the vasoactive moieties. Physician and other health care providers should include a detailed history of exposure to herbal preparations, including those found in popular soft drinks. Mechanism for reporting adverse reactions to these products when used as a dietary supplement are involving current opinions, including use of the Food and Drug Administration MedWatch program, where you can list the drug and have the FDA follow it. Only through aggressive reporting and critical scrutiny will we be able to determine if legitimate public health risk exists from herbal compounds in energy drinks and other sources. I listed the references on my blog also because they have articles like this one. Chen et al. Published an article in Journal of Neurology Science 2004 entitled Ischemic Stroke After Using the Over-the-Counter Products Including Ephedra. And another one by RYU published an article in Neurology in 1995 entitled Ginseng Associated Cerebral Arteritis. How do energy drinks cause the bleeding? Anyone who's ever blown up a rubber balloon until it pops has an idea of the situation. The increasing air pressure or breath blowing in the balloon stretches the rubber of the balloon as the side of the balloon grows until finally the filament of the rubber gives way, the balloon pops, and then collapses as the air pressure is released. Chemicals that cause increased blood pressure in cerebral arteries react in a similar fashion. The pressure in the artery increases, the vessel wall stretches, and finally it rents, depositing fresh blood into the substance of the brain, which is a hemorrhagic stroke. Because of the nature of the vasculature of the human brain, the rupture is commonly deep in the middle of the brain in the thalamus, which is supplied on both sides of the brain by what are called the lenticulostriate arteries, which are tiny arteries supplying the middle of the brain, which are usually the first to blow in this scenario. Are energy drinks dangerous? The answer to this question seems obvious by studying the case presentations in this article. Energy drinks can cause accelerated blood pressure that then stretches, ruptures an artery, and causes bleeding into the brain. All energy drinks are supplements, which, as mentioned at the beginning of this article, are not controlled by the FDA, although in the news through the year, the FDA has threatened to take over the supplement industry and regulate it, but they just haven't done it yet. Consider that caffeine, first mainly in Coca-Cola, was regulated by the FDA early in the 19th century. Also, as a final statement, the FDA has repeatedly advised doctors to tell their patients to not take supplements, and I have said this innumerable times to patients in my own office. So it's in the dictation on this subject. Please click subscribe down there so we can follow each other. God bless all you persons who have taken supplements and have high blood pressure, and be careful with this. I'll see you again on the next talk.